Do I need to continue doing injectable treatments such as Botox and fillers and skin services such as microneedling and laser skin resurfacing after having surgery, facial cosmetic surgery? This answer really depends on each patient, and there's no one size fits all answer, but from a professional standpoint, I vote yes, and let me explain the reasons why. One of my first recommendations is to continue doing neurotoxin like Botox Xeomin into the upper third of the face, forehead, between the brows, and around the side of the eyes. The reason for that is when patients are having eyelid surgery and brow lift surgery and rejuvenating the upper third of the face, we are fighting gravity. We are essentially going against the vectors of gravitational descent. Botox also is able to do that in the years after surgery when we know that natural, gravitational, and age-related changes are occurring. So because we only have one lifter of our forehead, one muscle that is an elevator, by suppressing the depressors of the brow that constantly act to push it down, we are essentially creating additional lift and not really giving those depressors a chance to chronically act on the tail of the brow as well as the medial brow to assist gravity in going downward. So we're able to maintain the results of that surgery longer and better. Another recommendation I have is to continue with age-appropriate, conservative volume repletion, and this could be done with hyaluronic acid-based dermal fillers in the years after, for example, a mid-face and a facelift surgery. We are not immune to continued aging after surgery. We're not immune to weight changes, weight loss, menopause, which also produces significant changes in the face. When patients are trying to maintain their results, it's important to just have that trust and relationship with your provider to consider some volume addition in some of the parts of the face that are sensitive to volume loss, such as the nasolabial folds, in the anterior cheek, a little bit around the corners of the mouth, maybe along the upper lip. Small additions of stylish, tasteful, conservative filler are always going to be natural and escape the radar of other people noticing. And finally, my third and best recommendation for maintenance of rejuvenating surgery is going to be the neck. So the platysma muscle is a very active, dynamic muscle. When we talk, when we express, this muscle acts like bowstrings, and it kind of, it becomes apparent, especially in thinner necks, long necks, or just patients who are very dynamic and have a very strong platysma. Surgically, we manipulate the platysma. We bring it together, the edges, sometimes we trim it, we lift it laterally, we do a lot of manipulation, but we don't paralyze the muscle and we don't stop it from acting. We take the excess out and reconstitute this hammock, but the platysma is still very active. I have a little bit of Botox in my platysma, it's probably wearing off, but to basically relax that with neurotoxin after surgery and prevent those contractions and prevent that downward contraction is also extremely beneficial for the maintenance of neck lift surgery, and I always recommend that to my patients. And if you've met me in the office as a patient for a consultation, you know that I always recommend investing in skin. I think I call skin the wrapping paper of the face. Surgery kind of creates the shape of the box and makes everything tucked and nice, but the wrapping paper is so important. And no matter what the shape and the structure and the jawline that you have, whatever assets you have anatomically, they can be overshadowed and diminished by sun-damaged, uneven, large porous skin. And I think laser skin resurfacing, depending on the intensity that it's performed, can be done once a year, once every 2 years, maybe light laser treatments throughout the year. This is one of the best investments because we are constantly fighting the sort of senescence of cells in the skin, the natural aging that will occur, the thinning, and there's nothing like a laser skin resurfacing to rejuvenate the texture and appearance of your skin.